Okay.
All right, so we are going to record this webinar because we want to be able to, if people that might have missed it, we want them to be able to hear it again. But my name is Jenna Pedoni. I am here with Biote, and I'm super excited to introduce someone that you guys probably already know well, but Dr. Jonathan Brajtbord, as an integrative urologist, he brings that really interesting integrative approach, combining clinical nutrition, lifestyle, emotional health with his surgery. He specializes obviously in urologic care, men's health. He understands the unique role the physician plays at this critical time in your life. So with that, I'm going to turn it over to Dr. Brajtbord. He's now in the Dedham location. So if those of you haven't seen him up there, you'll have to be going there, but that's at 910 Washington Street. And we're excited for Dr. Brajtbord to talk about his new venture and what he's doing. So take it
Awesome.
away.
Awesome, Jenna. Thank you so much. And I'm super excited to be doing this seminar with you guys tonight. This is geared a lot for men, but there's definitely a role for hormonal therapy and hormonal health for women too. So I'm going to try to touch on a few of those points, but this is also something that is really beneficial for women as well too. I'm going to kind of go through kind of the talk tonight, and a lot of this is I have changed a lot about how I think about hormonal health, how I approach this topic. And I'm going to try to keep kind of highlighting those things because my education and my thought process has changed a lot over the last few years. So with that, we're going to talk about Biote. Something small can make a big difference. We're going to go. So kind of our objectives tonight are three crucial things you need to know about your hormones at any age. All right. So number one, why they matter. Number two, what does the scientific evidence say about hormonal therapy and the importance of testosterone and estrogen, and how to identify the treatment options for you, and kind of go from there. So those are our three big objectives that we'll get to tonight. So why do hormones matter, right? So oftentimes, men who feel that their hormones aren't optimized can have a decreased sex drive or performance. Right? That's kind of very much in the pop culture, right? Low T, you're not interested in sex. Like we kind of associate those two things together, but they also have a lot of extreme fatigue or weight gain. All right, muscle loss, brain fog, joint pain, low energy, right? These are all symptoms of having low testosterone. And then what that can cause and how that represents in your life sometimes are things like mood swings, feeling anxious, very irritable, lack of sleep, memory loss, more depressed or sad feelings, and kind of a lack of focus. Okay. Now, many of you patients, many of you men have heard me talk about, well, testosterone is not the only thing that can cause this. And by no means do I mean that's always the case. Oftentimes, right, what we eat, what we drink, how we exercise or not exercise, the sleep that we're getting, right, those can all contribute to those things of feeling overwhelmed, or mood swings, feeling stressed out, feeling anxious. And what I have found is that when you add testosterone to this mix, right, when you add it as part of the components that can help men as they start trying to feel better, you can have a really huge synergistic effect to all the other things that we're trying to do with our life, which are to work out, eat better, and get better sleep, right? And manage our stress this way. So I really see it as an additive and a cumulative effect for these more holistic lifestyle changes that we're trying to make. So are you living life to your fullest, right? Are you able to really enjoy your time in your life and not just kind of slog through and get through the day, right? Are you able to enjoy coming home and being with your partner? Are you enjoying seeing your kids or your grandkids, right? What are you doing on the weekends or after work that you can actually maximize your life? Right. How do we shift and transition out of this just, kind of like getting through the day to really optimizing it and thriving in your life? And I do believe that hormonal health can play a huge role in that. So this is kind of a picture of the different areas that hormones can impact in your body. And this is, I really want to stress here that a lot of the education that at least I personally got as a resident in a medical school touched very little on kind of the endocrine system and the hormonal system as it relates to replacing to really optimize health. Right. So kind of going back and doing more education, more training on this, I've really seen the wide array of symptoms and impact that it can have, right? So hormones regulate activity of cells and organs, right? They regulate the body's growth, metabolism, sexual development, and function. All right. And then when they're out of balance, disease can develop. Okay. And importantly for us, right, our hormones can be impacted by genetics, right? But not all things are just our genes, right? There's also aging, right, that shift our hormones, as well as lifestyle, right? We talked about that, kind of what you eat, how you are during the day, your nutrition, your sleep, your exercise, right? What medications you can take, right? What prescription drugs you're taking, as well as your environment, right? This can all impact your endocrine system. So we have testosterone receptors that are literally all over our body, right? Everywhere from the brain and the eyes, all the way down to our skin, our bone marrow, lymphoid tissues, our blood, right? And then specifically, they're in the male tissues, right? So they're in the male they're in the male reproductive systems, right? So the prostate, the seminal vesicles, right? The testicles, and in the female, the vagina, the ovary, fallopian tubes, right? Breast, things like that. So they really have receptors all over their body, which really again speaks to the wide variety of different functions that they have. So hypogonadism, right, or low testosterone deficiency in the adult man is a clinical and biochemical syndrome associated with a low level of testosterone, which may adversely affect multiple organ functions and quality of life. Okay. So it's not just a lab test. We don't just rely on just a lab test, but it's also a clinical definition. We'll get into that a little bit later tonight as well, too. Right. And so this kind of character on the right side really kind of dives into the different areas that testosterone can impact, right? So your mood, right? Decreased motivation, right? It can impact your hypercholesterol, right? And high blood pressure. You can develop gynecomastia, which is the medical term for man boobs. Okay. Dyslipidemia, so where your lipids are out of alignment, right? Diabetes or insulin resistance, obesity, and fat. These are all related to or can be related to low testosterone. Same thing with erectile dysfunction and decreased libido. And osteopenia and osteoporosis, especially for women, is huge, right? So, the real important to understand is that a large number of men have kind of clinical symptoms of hypogonadism, right? But it still remains an underdiagnosed and untreated condition, right? So, where does this kind of andropause? So we know that testosterone levels continue to drop 1 to 3% per year, right? And low T has been associated with an increased risk for diabetes, high blood pressure, sleep apnea, and other chronic diseases, right? Cardiovascular disease, some dementia. Okay. So low T has been linked to early heart disease, and men can start dropping their testosterone levels in their 30s. Their data is out there that more and more men in their late 30s and early 40s are having lower testosterone levels, right? Our testosterone levels are dropping. And there's a lot of different reasons to why that is, whether it's environmental, the microplastics that are in our environment, but no one can doubt that men younger and younger are seeing lower levels of testosterone. So the question is, what do we do about that? How can we help to adjust for some of these issues so that we don't have chronic disease long term as it relates to having low testosterone? Okay. So hormones can help us feel better and protect our brains, our bones, our heart, and our relationships. All right. So the idea is to kind of optimize us to have healthy aging as we move forward. So this is a little bit busy slide, but what I really want you to take away from this is that potential benefits of a balanced hormone system really run the gamut, right? So we have increased energy and vitality, right? The feeling that you want to do things again, right? This motivation, right? Improved feeling of overall well-being, right? Relief from feelings of depression or anxiety, improved cognitive clarity, right? Better memory, better focused, enhanced libido. Sure, that is there as well too, but we have all these other areas that we can also see improvements in. Okay. So heart protection, bone protection, increased bone strength, reduced body fat, lowered cholesterol. And again, the way I see testosterone playing a role in this is I have men who we can get their testosterone levels higher, right? For sure. But if you're not changing your diet, if you're not exercising, if you're not kind of engaging in those lifestyle changes too, we're really fighting an uphill battle. And you might not see the benefits of just having higher testosterone, right? And trying to get men motivated, trying to get women motivated to exercise for the first time, to eat healthier, to make those lifestyle changes when your testosterone is plummeted, right? It's an uphill battle. So that's again that synergistic effect of combining the lifestyle changes, as well as our hormonal optimization. All right. And that's where I think the true beauty of integrated medicine is. So really important, low thyroid is part of something that we look at through this Biote method as well too. Oftentimes men who have low thyroid have fatigue, sensitivity to cold, constipation, weight gain, puffy face, muscle weakness, right? And oftentimes, right, one of their biggest complaints is this slow metabolism, right? Where you're unable to lose this weight, or you have this weight gain. And oftentimes our testosterone, our thyroid labs are normal, right? And so then you're told, oh, you have a normal thyroid. But what is the actual optimal levels of thyroids? And how can we help? How can hormones help to kind of clean up the receptors? How can we use some more probiotics and some more gut health to really clean out your system to be able to have your body utilize your thyroid system on a much cleaner basis? Okay. So that's all part of this process that we try to look at as far as optimizing your hormones. So what does the literature say, right? So this is great. It sounds great. It looks good. But like, what are some of the data out there looking at this? So what is normal versus optimal? Okay. And I often say when we draw labs for patients and I give them a call with their results and I say your testosterone is low, it's 275. Well, what's normal? Our normal ranges can range anywhere from some labs is 250 all the way up to 900, right? It's a huge range. Okay. Most urologists would say that the actual normal range is more around 300 as a low end of normal, all the way up into much higher ranges of 900 or so, and even 300. Men with testosterone levels in 300s and 400s, right? Although clinically they have all these symptoms, right? Their labs are quote unquote normal, all right? But they are actually experiencing these clinical symptoms of having low testosterone. Okay. And so for that reason, we say it's a clinical diagnosis, not just a laboratory diagnosis. And I know so many men who don't want their testosterone to be on that low range of normal, right? They don't want their testosterone to be 350. They want it to be 650 or 750, right? If not higher, because that's again where we begin to see some real benefits as it relates to all these other systems that we've been talking about. Okay. So when we look at brain protection, right? So men with low testosterone are 3 times more likely to develop Alzheimer's disease. All right. Women who get Alzheimer's disease at a much higher rate than men, right? 8 to 1, right? Women on estrogen are 50% less likely to develop Alzheimer's disease, right? And this is a disease that we don't treat well in the medical community. We do not know how to treat this. It is a long-term chronic condition that is terrible for patients, for their families, right? To see them go through this. And there's very little interventions that we can do. Why not try to prevent Alzheimer's in the first place, right? When they've looked at studies, they've looked at abilities for how can we prevent this, right? Elevating your levels of your testosterone for men, elevating your levels of estrogen and testosterone for women have been shown to be protective in this area. All right. And if that's not bad enough, bone health, right? So we all know the risk of falls and fractures, okay? And 10 to almost 20% of over 6-year-olds have osteoarthritis, okay? Joints hurt, we have pains when we use our joints, okay? Both estrogen and testosterone can stimulate precartilage cells, possibly reversing the damage of arthritic tissues. All right. So then you've kind of gone through your osteoarthritis, right? Maybe you've had that knee replacement or that hip replacement, right? How can you prevent needing to revise that surgery, right? So when they've looked at people who are using hormonal therapy, right, it's associated with almost a 40% reduction in the revision rates of your total knee or your total hip. All right. So now we're laying the groundwork, we're laying the bone work literally to help prevent injuries and osteoarthritis and osteoporosis, especially true for women. All right. So just on the osteoporosis, right? So testosterone has shown to be the bone builder, right? It's demonstrated a 4-fold increase in bone density over oral estrogen and 2 times greater than any sort of estrogen patches that you might be on. Okay. And we look at the pellet therapy, right? We have an 8% per year improvement in our bone density for testosterone replacement therapy, right? This far out exceeds patches or oral estrogen, right? So for the prevention of osteoporosis, it's huge, right? And there's actually been studies that reverse osteoporosis when you're on testosterone therapy. All right. Heart disease continues to be the #1 killer for both men and women. Okay. And it's a huge cost to our system and to patients. All right. When we look at the incidence of cardiovascular disease in men with erectile dysfunction, right, with no prior cardiovascular event, all right, we can see that as the ED starts, right, it's like that canary in the coal mine that you have issues in your cardiovascular system, right? And 7 years later, right, the cardiovascular events, that's a major event, and myocardial infarction or a heart attack, right, reaches almost 15%. So we know that these men are at risk. How do you help prevent, right, the cardiovascular disease and revert and hopefully reverse some of that impact on your system? Okay. And testosterone plays a huge role in that, right? It's a heart protectant, right? So testosterone is shown to decrease the total cholesterol, right? As well as LDL, that's your bad cholesterol, and triglycerides. It's going to increase your HDL or your good cholesterol, if you will. All right. You have a marked reduction in fat and improved lean body mass, which from like a inflammatory standpoint, a lot has been thought to be due to a pro-inflammatory markers from adipose, from fat tissue that gets deposited in your abdomen, right? And there's a reduction in that and an improvement in your lean body mass, right? This isn't always about weight loss, right? Because remember, muscle weighs more than fat. So you will lose fat and gain muscle, but your body composition is going to be changing. Okay. And it's been shown to decrease plaques and inflammation in the arteries and improve blood flow for the heart. All right. Again, to stave off and hopefully reverse and prevent those major cardiac issues. When we talk about women and hormones in the heart, right? Again, trying to bring in, some of our female patients as well too, right? So estrogen replacement with pellets has been shown to have a positive effect on body fat in postmenopausal women, as well as improved lipids, right? So again, similar to men, we're going to decrease the total cholesterol and your bad cholesterol, and we're going to improve the HDL. Okay. Now, many studies again continue to show the benefits of testosterone on the heart, right? And you see that both for testosterone and estrogen for women, right? So oftentimes, this is the point of the talk where I like to pause. And so oftentimes patients will say, well, what are the side effects, right? I've heard hormones are so bad. I've heard that my primary care doctor doesn't want me to be on hormones. He says they're really not good for me. And I think it's really important some context. Okay. So even when I was going through medical school and when I was going through residency, which was not that long ago, right? Again, we were not taught about these kind of hormone treatments and therapies or the benefits of it. And if we were, it was really kind of labeled with like a black box, stay away from it. And that often had to do with studies that were presented earlier in the 90s. Okay. And when they've gone back and looked at a lot of that data, testosterone does not cause cardiovascular events. It does not cause blood clots, right? It does not cause breast cancer in women. These were all things that we were kind of taught to be true. And the reality is when you look at the data, it's just not actually there. Okay. So this is a really important trial. That's a multi-center randomized double placebo controlled study, double blind placebo controlled trial. It's like the gold standard of medical trials. All right. And in this trial, right, it documented that testosterone therapy is safe and does not increase major adverse cardiovascular events, right? MI, stroke, or death due to cardiovascular causes, okay, in men with low testosterone, okay, as well as men who have low testosterone and high cardiovascular risk disease, right? So it is safe to treat these men who have high cardiac risk disease, all right, with testosterone. It does not increase these negative outcomes. So when we look at the benefits and the risk of these, it's really not, in my opinion, the data has not borne out to be the case that you're going to have a lot of cost, that you're going to have a lot of these significant side effects from the cardiovascular standpoint. Now, there are things we need to monitor, right? There's are things that we need to monitor as far as your blood levels and things like that, which we'll get into. And we don't just say, all right, here's your therapy. We're going to see you later, right? That's not what it's like when you come to Greater Boston Urology. It's not what it's like when you come for me as a provider. I think you guys all know that. There's ways that we follow up with you, and there's ways that we can actually really make sure that we're operating within safe parameters. Okay. So when you look at testosterone replacement therapy, right? So we talked about all the benefits of it, right? We talked about that it's safe. Okay. So there's different ways to supplement or replace your testosterone. Okay. There are bioidentical hormones, right? What is the molecular structure is the same as that's produced in the body. And then there's synthetic testosterone. And oftentimes it has to do with how it gets delivered. But I have really gravitated towards seeing the benefit of bioidentical testosterone as opposed to something that was made synthetically to mimic, but not exactly match what your body naturally makes. Okay. So again, some of you have heard me say this when we've been in the office together, but there's different ways to deliver testosterone. Okay. Oral is not really a great option. There's a new oral testosterone treatment available. Um, the studies they do not say that it works that great to raise the levels to what we want. But there are some buccal or sublingual forms, which are like under the mouth, or like that are absorbed in the mouth or under the tongue, right? But these have to be dosed 3 times a day, and they have very short half-lives, which means you're going to get a peak and then a crash, and a peak and a crash. All right. Oftentimes you've heard me talk about like there's creams, there's gel, there's patches, right? Now this has to be put on the skin either once or twice a day. All right. And you're really relying on the skin to absorb the medication. Now you can have huge varieties as far as what gets absorbed from patient to patient. All right. And they can get rubbed off onto other people, kids or grandkids, which obviously we don't want. All right. There's injectable treatments, which are either injected weekly or every other week. All right. There's long acting injections. But again, these injections and the long acting injections, these are more of the synthetic testosterone. They are not the bioidentical ones because they had to be mixed in an oil based medium. Usually it's cottonseed or grapeseed oil, and it has to be injected into the skin, and you're getting all the synthetics of not only the oil but also the synthetic testosterone. Oftentimes when we put men on these injections, and right, the common one that we use is testosterone cypionate, your T levels will go up and then down, so you have this kind of like roller coastering, high fluctuations and then crashes before your next dose. Either that's a week or 2 weeks. Okay. When we have these high peaks, right, two bad things can happen besides just this kind of like peak and valley. All right. You're going to have increased chance of getting your blood clots, getting your blood more thicker, right? That's called erythrocytosis. It stimulates our red blood cells to be more thick and can increase the risk of strokes that way. Or we call aromatization, which is the conversion from testosterone to estrogen, which happens in everybody. But when you have these high peaks, right, you have a greater chance of doing that because the body is like flooded with testosterone. Says it's too much, we're going to shunt it all to estrogen. Okay. The final mode of delivery, it's something that I'm very much getting into now, is something called pellet therapy. Okay. And these pellets are delivered under the skin, right? And they allow for much more consistent levels through over time, as opposed to these kind of peaks and valleys. Okay. It's a procedure that gets repeated about every 3 to 4 months for women and about every 4 to 5 months for men. Okay. So you don't have to worry about creams on a daily basis. You're not worrying about needles once a week or once every other week. There are some downsides to it, right? So they have a little bit of restrictions after you do the procedure, and there is a possibility that one of the little pellets, um, which are they look like little pieces of rice, can be extruded. Now we know, sometimes it happens. It's very rare, but it does happen. So those are kind of the different routes of delivery and why it's important to kind of choose what's right for you. So we went over this a little bit, but just for injectable testosterone, right? We have this uneven absorption, this significant roller coaster up and down. It's mainly a synthetic hormone, all right? And you have increased risk of, erythrocytosis, which is a thickening of that blood, as well as you can have some more dyslipidemia around that. Okay. Um, I think it makes guys cranky because they're pissed. They're not ready for their next shot and they don't feel well, right? Because they've gone up and then they've crashed down. Okay. So bioidentical hormone pellets, right? So these are the pictures of them you can see in the gentleman's hands on the right hand side, right? These get injected under the skin. Okay, they are natural, they are plant derived. They actually come from yams or sweet potatoes, if you really wanted to know. And they have the same molecular structure as human hormones. Okay, so again, for women, they last typically 3 to 4 months, and for men, about 4 to 5 months. All right. And what they do is the hormones get released over time based upon your we call cardiac output, or how much blood is circulating through your system. And that more clearly mimics how your body naturally produces testosterone when it calls on it as it needs to be done, when you're working out, when you're doing some strenuous work, but there's always that more consistent dose that's there. Okay. It's implanted under the skin, as we mentioned. Procedure itself takes about 20 to 30 minutes. Okay. So some takeaways before we get there, right? So hormones matter, right? They affect every system in our body, starting in our 20s and 30s. They can benefit the brain, the bones, and the heart, right? And there's not a one size fits all, right? There's different types of delivery. I have met, even though we're doing this pellet therapy, I have men who still want to do the injection. That's totally fine, right? The idea is we're trying to optimize your testosterone system to be able to get the benefits of the therapy. Um, and all right, this is where I want to get into this. So I am so excited to be partnering with Biote, right? Because I truly believe in this company. They are incredibly invested in high quality products. So when we talk about pellet therapy for testosterone, there are cheap options out there. There are options that people mark up, and the quality of the pellets that are delivered are absolute crap, right? They are not good. Biote make sure that all of their products are within a 3% error, where standard is 20%. All right. So it's a 3% error between the quality of the pellets that are delivered. It's the highest quality pellets you can get out there. And we have a huge resource, right? What's great about this is that we're individualizing and personalizing your therapy dose based upon the labs that we draw, your age, your weight, your activity level, right? Along with these labs, these more objective data gives us personalized dosing for you that we can then tinker with over time. But we're not just throwing a dart on the wall and hoping that we get the right dose, right? Or with these long-acting injections that we hope that we can like get you where we want you to go, but we really can't adjust the dose that much. Okay. So it all starts with this whole method that includes education for physicians like me, right? Understanding what labs we're getting, right? Using our clinical support software that's going to help us to generate a personalized dose for you, right? I kind of mentioned these quality pellets. And then we really educate the patient, right? So this is not just, see you later. I really try to, and some of the men who've had this therapy, already, again, we really talk about, hey, make sure you have to start exercising, you have to start eating right, you have to start sleeping well, right? We have to do these lifestyle changes in order to really see the maximum benefit of the testosterone, right? In addition to that, right, like we are doing nutraceuticals, which are pharmacological grade supplements that's going to help you maximize making sure that your testosterone stays in the pathway it's supposed to. Making sure that we're optimizing your vitamin D levels, all right? Your methyl factors, which can help with a lot of the processing in the body, right? So we give our patients access to this, and it's really clean, good supplements to help them really optimize and utilize the testosterone that we've given them. Okay. Um, and that's part of what the Biote system is. The reality is that this is a system and this is a service that is not covered by insurances. It's not covered by commercial insurances or Medicare. It is a cash-based system. And the way I try to help understand and educate patients is you are really investing in your overall health, right? Whether that's for health for osteoporosis, for your bone health, cardiovascular health, or your brain health, as well as your overall physiology. So for men, again, we do approximately 2 to 3 procedures per year, and it's $800 per procedure. And for women, it's about 3 to 4 procedures a year. And it's $500 per procedure. So you're looking for men, I have them budget about between $2,000 and $2,400 a year for the treatments. And for women, it's around the same. It's about $1,500 to $2,000 a year for the treatments. So when you look at it, it's actually cost just under $8 a day for both men and women to access to have this benefits through this through our Biote method. Okay. Um, so I'm very transparent about that. I don't hide that from my patients. It's not a surprise. This is all part of the process in order to, I think, really have the best quality testosterone replacement therapy. So the next steps, if you are interested in this, right, is getting your labs drawn, right? So kind of what I would encourage you to do if what we're talking about tonight really appeals to you and it's something that you're really interested in, I would love for you to call our denim office. And that number is 781-762-0471. We will send it out with a recording of this tomorrow as well, too. So you can make an appointment to get your labs drawn. We're running labs through insurance and it's all typically covered. Okay. So we draw some labs. And then I'd love to have you guys make either an in-person appointment to discuss this more or a telehealth appointment with me. And we can go over your results and we can kind of answer any questions that you have about what this procedure looks like. And then if it's a yes and it's a go ahead, we schedule you for the procedures. Again, they take about half an hour or so with a little incision either in your butt or your flank. There's no stitching. There's very little bleeding at all. You have a little bit of you're a little sore where we put the pellets in for about a day or two. But then you're kind of much more back to your normal routine. And you're showering the next day. And again, this is a very small office-based procedure that I think can be really beneficial. So I'm just checking the time, just over half an hour, which is great. So I'm happy to open up to any questions that you have. Jen, I don't know if you've been fielding questions in the chat box. I forgot to mention that, but if anybody has questions, please drop them in the chat box and Jen will read them out to us because I can't see the chat box, and happy to answer any questions and go from there.
Okay, I just checked. I don't see any right now, but I'll give it a look.
That means I answered everybody's questions during the talk. Great. Is there anything that I missed that you want to make sure to highlight? I know since you've been around this for quite some time.
Yeah, no, I think you covered a lot of it. Oh wait, a question did come in. Let me check that. It says, does the government health plan accept this treatment? And like low testosterone levels can be considered a disease.
Yes. So there are treatments. That's a great question. There are treatments for low testosterone that are covered by government insurance, commercial insurance. This treatment is not. This treatment is a cash-based treatment. We can give you paperwork if you want to submit it to your insurance to try to get reimbursement for it. But the Biote to pellet therapy is a cash procedure. If you want to go through the insurance route, I'd encourage you to talk to me about, testosterone cypionate or a V, the long-acting injections. And again, sometimes men feel good with that, and there's nothing wrong with that. I meet every guy where they are, as far as what treatments they're willing to go through. Oftentimes, I have found for men who have been on either cypionate or the Avid, their testosterone levels come up and they feel better, but they don't quite feel great. Right. And so some of the men who we've done this procedure for already used to be on testosterone replacement therapy through those forms. And they've switched to this because of the benefits of this kind of more sustained, long acting testosterone, as well as really the personalized dosing that we get. Right. So the short answer is yes. The long answer is it's still not covered. It's still just a cash based procedure. So I hope that's helpful.
Great. The next question that came in was, how long has Biote been in business? And I don't know if you know that. Do you?
I want to say at least 10 years, but I want to say 2000. What's that?
Yeah, it was like around 2010. And
Yep.
then we were a private company, and then we went public in 2022. So been public for a couple of years, and you can look us up on the stock exchange. but yeah, and pellets have been around since the late 1930s. So pellets are not a new treatment in Europe. Sometimes in Europe, things that don't get covered here, everybody's doing pellet therapy for testosterone in other countries. So very
Yeah.
safe.
And I think, I think oftentimes what happens in healthcare in America is really dictated by insurance companies. And, it's just, again, it's different practice patterns, different lives, different insurance companies here. And there's over 7,000 Biote providers. So this is not like, a rogue urologist or a company, right? This is a really well-respected company. And again, like there are cheaper companies and cheaper products out there, but the quality that I've seen through Biote, both through their pellets and through the nutraceuticals and the supplements they have, are really second to none. So great.
Okay, so the next question is, if you switch from intramuscular injection to the pellets,
Yep.
is there a weight or drop in testosterone before the pellets start to show results?
Great. So what I would do if you're already taking testosterone replacement therapy, we can work with the timing of your procedure. So from essentially from the time that we do the procedure, it takes about 7 days to see the benefit of the pellet therapy. That's when you get the vascular bed. That's kind of where the pellets are. That's where you start to see kind of really the symptom improvement and the physiologic benefits. So I had, I have one gentleman who took a dose of his testosterone cypionate, was like his last dose. The day we did the procedure, he took like a smaller dose, and then, by a week later, his pellets will be working and his cypionate will be out of his system. All right. So we kind of worked and timed it that way, so that he didn't crash trying to wait for the pellet to then work.
Yeah, and I'll just add, if there was somebody who maybe was on a twice weekly
Yep. Even better.
injection, they may actually need two injections. That
Yep.
right, they would get their pellets, take an injection, and then do the second one. But then after that, no more.
Correct.
Okay,
Yep.
great. So the next question that came in is, I just want to say my sister has been on Biote for 10 years and swears by it. I had no idea she was doing this. I just got my first dose Friday and I'm looking forward to seeing the difference. Oh, all
Awesome.
right. Not really a question, but that's great.
I think what's amazing is oftentimes when you start talking about this with either friends or family, people go, "Oh yeah, I do this," but there's still this feeling of trying to keep it a little bit in the closet and not talk about it. We want to keep kind of keep private about it, which is fine. Everybody's in their own right as far as what they want to share from a medical standpoint. But I think it's growing more and more popular with people, both men and women, because we don't want to just live longer. We want to feel better as we are living. And I can't tell you the benefits that I have seen in patients when their testosterones are and their estrogen for women, their testosterone for both women and men, right? Because women have testosterone too. Right. When those get back up to more physiologic levels, like the quality of their life dramatically improves, right? And you also have all these protective effects that we talked about, and they feel so much better. So
Excellent. So the next question is, how would this affect a man that has an enlarged prostate?
It's a great question. So they've done studies looking at symptoms of men with large prostates and testosterone replacement therapy, and the symptoms do not change. Okay, that's what the data shows. Now, good. That's one of the reasons that it was nice to coming to a urologist for this, is because if your symptoms do change, right, we can help manage that, right? We can change, we can kind of work with you with those symptoms, but the data would suggest that it does not change your urinary symptoms being on testosterone replacement therapy. So there you go.
Excellent. And I think the second part of his question would pellets possibly be better than being on other types of testosterone, low, things that would help the low T? Do you know
Yeah,
if kind of comparing pellets to maybe another type with someone with enlarged prostate?
fair enough. So I don't know if they've done studies looking at the different modalities for how that relates to enlarged prostates. I will say I think the benefits and the drawbacks for the transdermal, right? The creams, the gels, the injections, right? That relates more to the actual delivery of the testosterone than the enlarged prostate symptoms. I don't think they've been able to parcel out, is one better than the other. I would say kind of from a, yeah, they haven't been able to parcel that out. But what's good is that there have not been changes to your symptoms because, again, kind of from my training, I would have assumed or thought that the higher your testosterone, the more symptoms you have. And that's actually just not the case. So,
Excellent. So that is all the questions that have come in so far, Dr. Brightbird, but it was an
okay.
excellent presentation. And so if you have any final thoughts.
Um, No, I think, I oftentimes think of or try to help patients understand that, you have lots of different options out there. And my goal as a physician is really to, and what I really stand for from this integrative approach is trying to see testosterone as part of the equation. I think it can be a great and it can be a huge part to get men jump started, to get their motivation up, to get their energy up, sleeping better. And it's just my last plug for, like, if we just do your testosterone, right? And you don't focus on the lifestyle, you don't focus on the eating, you don't focus on the exercise, right? You'll see some benefits, but you're not really going to see the optimal benefits. So if you're going to invest their time and you're going to invest your money into this program, into these things, like, be committed, right? Be committed to shifting up how you eat, shifting up how you exercise, shifting up how your lifestyle really can impact your overall health. So again, I think this is a great option. It's personalized, bioidentical testosterone replacement therapy. If you're interested in other questions, feel free to come see me in the office. Feel free to schedule a telehealth. I kind of like, call to action is like, let's just get some laughs, right? Let's start there. Let's see where things are at so that we know what we're dealing with, right? And, kind of go from there. So if you do call the denim office and schedule a lab appointment, they'll know what labs to get as long as you say that you're looking to possibly do a Biote procedure. We have it all mapped out for you. And then schedule that lab appointment, and then make that telehealth or follow-up appointment after that. We'll go over the results, answer any questions you have about the procedure. We'll go from there.
And just to clarify, I know somebody asked about insurance.
Ah,
Am I right, Dr. Brightbird,
yeah,
that the lab and the telehealth can go through insurance,
correct.
just
Yes,
not the pellet procedure?
correct. Thank you for that clarification. It's very important. I appreciate that. Yes. All right.
Great. Well, thank everyone for joining. We hope you got a lot out of this. If you have follow-up questions, you can always call into the office, but like you said, it starts with a lab. So have a great night. Thanks for attending the webinar.
Thanks, guys.